Hi, everyone. Thanks for joining me today. I am Prottusha Sarkar. I'm an MDMA student at Northwestern University and also the Health Equity Research Fellow at the South Asian American Policy and Research Institute, also known as SAAPRI. We're a nonprofit, nonpartisan organization established in 2001 with the mission to serve South Asian Americans using research to formulate equitable and socially responsible policy recommendations. One of our key program areas is in health equity, which I am kind of the leader of that team, which focuses on bringing health literacy, awareness upfront, and to fight data inequities in healthcare to bring kind of to fully address the needs of the South Asian American population. So just, briefly about me before I introduce our wonderful guest here. So as both a medical student and the health equity research fellow, I'm really passionate about health equity as well as creating policy that increases access to quality care for everyone, particularly in women's health. That's kind of an area of special interest for me. This kind of goal brought me to SAAPRI to help understand and address the specific needs of the South Asian population, as well as to kind of work directly with the community, fostering those really important community relationships, and to help us implement initiatives to empower South Asians with the knowledge of their health. Today with us, we have Anushka Das, who is the operations manager for SAAPRI. And our special guest, Punita, who's going to be joining us for an exciting chat. A very quick brief bio on who Punita is. We are so excited to have her here. She's an international best-selling author, a healthcare executive, a patient advocate, and philanthropist. Her family represents the increasing multicultural population. Punita and her son Rahul have co-authored a book titled Mixed Desi: Stories of Multiracial South Asians. Their book describes the changing face of the South Asian diaspora, as depicted by over 60 courageous individuals who share their stories of the magic, mystery, self-discovery, and belonging to the interracial and multiracial South Asian community. So Punita is also a patient advocate and a lived experience expert speaker. And she kind of loves to share her experience about kind of being diagnosed, managing the treatment of breast cancer, as well as showcasing the diverse representation of individuals who are affected by the disease, and hopes to inspire others to explore their own treatment options. So we bring Punita here today to talk about SAAPRI's breast cancer report that we are releasing during the month of October, Breast Cancer Awareness Month. So Punita, you've been a really big part of SAAPRI's journey with working in kind of the breast cancer space, and we're really excited to have you here to talk about this report, which kind of is serving as the culmination of our efforts in uncovering the untold stories of breast cancer in the South Asian American community. This report is going to highlight kind of new research, personal narratives, and insights from experts to kind of shine a light on the critical gaps in awareness and care that we have in our community. Before we kind of talk about the report, Genesis, is there anything that you would like to say quickly?
Sure. Well, thank you, Prottusha. I'm glad to be here and be back with SAAPRI and having this conversation with you. I was diagnosed with breast cancer about 8 years ago. And that was the year that I thought that I didn't need to get mammograms anymore because they had been clear up until then. And what prompted me to get a mammogram that year was that within a span of a couple of months, at two different appointments, I asked both my OBGYN and my primary care physician, who happened to be female, if they still get their mammograms. I thought, well, they're around my age, and I was just taking an informal poll of women like me. Both replied yes, and their responses prompted me to schedule mine. So it was a total shock to me when my OB called me back a few weeks later and said my biopsy was positive for breast cancer. So as you know, my background's in healthcare management, and I've been very comfortable in healthcare settings. But now, being diagnosed with the disease, I started to look at things differently. And during this time, I also began working with a former breast cancer surgeon who had founded her own foundation, which was focused on breast cancer awareness, education, advocacy, and research. She had written the Breast Book, which is referred to as the Bible for women with breast cancer. And at the foundation, I connected with breast cancer organizations, patients, survivors, thrivers from all different backgrounds from all over the country. But one thing that struck me was that while there were organizations for specific ethnic and racial groups, Jewish, Hispanic, Black, and Asian, there wasn't one for South Asian women. We get lost in the whole Asian mix. So I never saw someone that looked like me depicted in brochures, at meetings and conversations or presentations. And then this lack of representation about our community was concerning to me, and I decided to do something about that. And so it was with that intention that I reached out to Shobna Verma, who's the executive director at SAAPRI, and shared my vision for the breast cancer series. And then fortunately, Shobna was receptive to collaborating. So the campaign started out with the breast cancer webinar series, which was held in 3 parts, all featured only South Asian panelists. The first one was the South Asian Patient's Voice, in which I moderated a panel with 3 other South Asian women who were also diagnosed with breast cancer. And this was the first time that we got to hear our community's experiences with living with the disease. And then, of course, the second panel, which was moderated by you, was with 3 medical experts discussing breast cancer treatment and research. And then I also moderated the final third panel, which was a discussion with community leaders about outreach, advocacy, and legislative implications of proposed bills pertaining to breast cancer. So all of these are powerful conversations packed with information that is still helpful to our community, and they can be viewed at SAAPRI's website.
All right. Thank you for that overview and kind of giving us that background. Yeah, just kind of like Punita said, we did the 3-part webinar series and followed that up with a survey of our South Asian American kind of community members to kind of assess their attitudes towards breast cancer, understand how South Asian Americans feel about breast cancer and breast cancer screening and treatments. Before we get into kind of talking about the report and the specific findings, I did want to highlight a new study that was released earlier this week that recently showed that among Asian Americans, those under 50 are now tied actually for the highest rate of breast cancer incidence with white women. I think that's just really important for us to recognize and kind of think about as we talk about breast cancer in the South Asian American community. It really is relatively common, much more common than we think it is. And we'll kind of talk about some reasons why we might not think it's as common as it actually is. So let's talk about the report in a little bit more detail. So I'm just going to give us a quick summary of kind of the main findings from this report, which summarizes, as Punita mentioned, our webinar series, as well as the survey research that we did. So to sum up, there were 3 main findings that we found from our research and from talking to people throughout the entire educational series. The first being that more educated respondents to our survey were more likely to have undergone cancer screening, any type of cancer screening in general. The second was that the more religious or culturally connected a respondent reported themselves to be, the more likely they were to kind of agree with or hold on to South Asian ideas about breast cancer. These include things like not feeling comfortable talking about breast health, preferring kind of like female physicians, ideas like that. And then some main ideas from our webinar series also kind of reinforce these points that South Asians are still facing barriers like not feeling comfortable talking about cancer, not feeling comfortable talking about breast symptoms, even with their physicians, worries about their family's reputation after a diagnosis with breast cancer, worries that they might be socially isolated or no one would want to kind of talk to them. As well as expressing concern, and Punita kind of touched on this earlier as well, that our current outreach methods and the education that exists about breast cancer is really not addressing these concerns that South Asians had. Also want to note, just very quickly before we kind of ask Punita what she thinks about these results, is that our survey did kind of have pretty high representation of people from highly educated backgrounds. So I just want to note that it was also an online survey. So we just want to keep all these things in mind as we interpret these results. All right. So after kind of talking about those results, like what are your first reactions to that, Punita?
The results are similar to what I've seen, surveys from other racial and ethnic groups, and demographics does explain some of the results that we're seeing. You have an online survey, you have, I think, over 80% were college educated or higher. And so you have to have access to a computer and be computer savvy. Um, you're probably working in a professional environment, so you have access to health insurance. You get information from your primary care physician. You can have time off for screenings, testing, treatment, things like that. So you have access to this type of information. People, and it starts to show some of the socioeconomic strata that, again, we have seen in other groups that different socioeconomic strata, you may not have access to even a regular primary care physician. You may have difficulty transportation wise getting to your appointments. And then, even before that, getting time off from an employer if you are someone who is at an hourly wage or relies on overtime. And you may not want to take that time because it decreases your income that you're bringing. So, these are some of the generalizations that we see in different demographics. So, your survey has proved that point also. And then similarly with the religious, culturally connected, you're not getting health information from your community organizations or places of worship. If that's what you adhere to and look to places like that for guidance, you're probably uncomfortable speaking about your own health, female anatomy, breast health. You're not just getting information about prevention, screening, self-exams in these settings. There aren't enough health professionals that are talking about it. So that's similar to some of the misrepresentations about cancer and breast cancer, that it's contagious. There's poor familial health that comes up, and there's also shame with getting any type of disease. So you see that. While we know that the incidence of breast cancer in women is 1 in 8 and 1 in about 833 men, 4% of women diagnosed with breast cancer in the US are younger than 40. So again, you have age separation in your demographics also, is that if you're younger, you're not really thinking about getting illness or getting a disease. And the median age of breast cancer is 63 in this country. So, again, we don't have any information on South Asian women in particular, like we do for Black women or other groups, but that's what needs to be studied. So the survey results are very helpful. And again, it gives us information to move forward.
Yeah, your point about age is really interesting, just kind of in light of that new study that was released that rates of breast cancer are actually increasing among younger Asian American women. And like you mentioned, and we'll talk about this when we talk about the recommendations from the report, is South Asians are not like disaggregated from that group, so it's hard to know exactly what's going on within the South Asian American community. But age is definitely important, and I think we should definitely be thinking about that when we talk about screening, especially with the newer recommendations from the USPSTF. I believe they recently changed the recommendation for mammogram and kind of made it to start at the age of 40, which there were a lot of different guidelines before, and now most people are kind of agreeing around 40 being that starting age. So just keeping that in mind also, that screening should start younger than sometimes we think it should. So, all right.
Prottusha, can I ask something here?
Yeah.
Screening, that is very important, that it should start younger. There's also something that I think that's missing in our community because we haven't talked about it here, but most of us are first generation, or our parents are first generation here. There wasn't databases, even in this country now. It's only been about 50 years we've been talking about breast cancer, but you can't look to your family or your relatives in India or a database and say, who had breast cancer? Because there's familial health that's important. And the age even shifts lower. If there's a family history of breast cancer, the recommendation is start getting tested and screening at 30. So there's a lot of discrepancy and a lot of information that we just don't have about our population.
Yeah, and I wonder if that's even compounded by the fact that even if someone did have breast cancer, they might not want to say that they did because of the hesitancy to talk about it. Yeah,
Exactly.
yeah. All right. So let's kind of review the main recommendations from this report. I think that they can kind of also kind of teach us a little bit more about our findings. So the first recommendation that we made in this report was to increase the presence of culturally sensitive health education programs. Um, this includes engaging with the media, with South Asian celebrities or South Asian influential figures, that they can be community or religious leaders. The second recommendation that we had was to have greater representation of South Asians in medical and public health research. Unfortunately, we are still severely underrepresented in medical research, and that makes it really hard to address problems when we don't even know what the problem is yet. The third is related to this. It's about data disaggregation. So disaggregating South Asian data from the Asian data that we have right now can also help us really describe and characterize the issues that are affecting South Asians specifically. And then the fourth thing that we talked about as a recommendation in this report was just getting greater insurance coverage for a lot of different types of screening and testing right now. So this includes things like dense breast tissue screening or genetic biomarker testing or kind of anything along those lines. So with these four recommendations, Punita, which one do you think would be like the most impactful?
I think it starts with an evolution. And you start, all of them are very important, but you can't do them all at one time. So you start with the first one is developing culturally sensitive health education programs and engagement with media, celebrities, prominent people, or any of us. For example, the webinars are a great resource to get out to community organizations and have them disseminate that to their networks, because we need to talk about it. And then representation is important, because if you don't see somebody that looks like you're not going to get it. Nobody's talking about it in your circle. Nobody's talking about it that they've had it. In fact, what's interesting is in my work in this space, when I started talking about it, and I was also hesitant initially, but I've had so many women from different ethnic groups come up to me and say, I had breast cancer, or I have breast cancer. I didn't tell anybody. So there is still that stigma. Maybe it's more uh, predominant in our culture, but there is that stigma about being associated with having a disease. So we need to normalize that this is healthcare, and healthcare is self-care is healthcare. And we need to do things to prevent it. And early testing and early screening can help mitigate some of the more aggressive treatments and therapies you might need later on. So definitely developing those health education programs through a wide variety of outlets. And we know this October, this is Breast Cancer Awareness Month. And then we have another opportunity in June, which is Cancer Survivor Month. And these are things that we've seen that's worked in mainstream America, again, in the last several decades. This is just a natural progression to not make it a stigma, but to make it something that we talk about, that it's important for people to get, and it's better for their health care. The other thing, too, is that I want to circle back to when I told my story, because this is important. We've seen the increase of women in the health professions here. And I looked back and thought about, when I started seeing physicians, they were mostly men. And it was interesting. You heard my question that I posed separately over about a 2 or 3 month period to first my OB and then my primary care physician. Do you still get one? And they were women. And I felt very comfortable asking them that question. And if they were men, can you imagine? I would not have asked that question. And I shuddered to think how much more aggressive my breast cancer would have been whenever I chose to have it. Maybe, maybe not, because I certainly wasn't thinking of getting it that year. And so this is important for our community. And this is why we need to tell stories like mine and others is we need to talk about it because we need to encourage this. Um, and so again, I think with that, we follow through with the other recommendations.
Yeah, I think about your story about having that female physician really kind of changed the course of you getting that diagnosis. And I also think about it's important for us to also have South Asians in kind of the other allied health professional groups as well, you know, nurse practitioners or PAs or nurses, just because anyone who can kind of talk to a patient at some point in the process can definitely have that influence that you were able to have. So our report was one of the reasons I initially came to SAAPRI and started working with them on this project and eventually started working with them completely on the health equity project was I had done this literature review looking at attitudes of South Asians in South Asia towards breast cancer. And one of the things that people expressed and that we found in that literature review was that people felt really uncomfortable talking to male physicians. They didn't want to
Mhm.
see a male oncologist. They didn't want to see a male breast surgeon. They didn't want to see a male plastic surgeon when it came to talking about breast reconstruction. So I think, you know, having providers that people feel comfortable talking to is so, so important. And we can't kind of, I think we've made so many strides in that in the past couple of decades, and I hope that we continue to make more. I wanted to briefly give talk about you mentioning that talking about breast cancer in the public sphere is really important to raising awareness of it. So I remember if, and I think you had mentioned this in one of our previous conversations, that back in the 60s and the 70s, even in the United States, breast cancer was so taboo. No one would talk about it. And then the Susan G. Komen Foundation started making breast cancer a really public issue. And then our first, two of our first ladies at the time, I think Betty Ford and Nancy Reagan, also kind of came out talking about breast cancer. Do you, I guess, like, what are your thoughts on doing something like that and the progression that we've made in the United States as a society going from, you know, the 50s and the 60s to now talking about it so openly?
Well, you raise really good points that we've discussed because the history, women, again in this country, what was it, over 100 years ago, were allowed the ability to vote. So it's all been a progression of women's rights. And healthcare was not, women were seen secondary citizens. And so healthcare wasn't important because it was run by men. In fact, if you even look at NIH awarded grants, very little has been given to breast cancer compared with other cancers. So again, women's health has had this evolution, and it started in the 60s with the women's liberation movement. So women's lived, and there was women's reproductive rights that were passed that have now been revoked. So in essence, we're almost going full circle in this country. What we have in terms of the revoking Roe v. Wade. So there's a lot of concern out there about women's health that we may be going back and may not even get as much funding as we have historically in the last 50 years. But that evolution started with the women's lib movement. Then it was the reproductive rights. And then as women started going more to offices and started working, becoming professional, the advent of the healthcare insurance industry rose here. So women had access to health insurance. And then you could start going to see your own primary care physician, which again, decades ago were primarily men. But medical schools have equalized that now. I think it's actually a higher percentage of women in medical schools than it was previous decades. So you were seeing this progression. There was a famous book that came out, Our Bodies, Ourselves, that's in the American media that came out, I believe, in the early 1970s. So women, again, American women, white women were really on this. And we need to do something like that with that for our community and South Asian women. I don't know what's available in South Asian countries. So there might be stuff, but at least what's over here is that the representation and increasing comfort level. And that's part of this education, information, getting people that look like you to talk about it, going out. community organizations like what SAAPRI is doing, but SAAPRI is one. We need to have several.
Yeah. To kind of talk about representation and research, in our report, we talk about Rutgers University. They have a new South Asian quantitative health department that aims to do exactly that and bring more South Asian representation into our medical research, and um, so that we can actually understand what the problems are and if there are differences in South Asians who are getting breast cancer. And also, one of the ways that we've been able to make such effective programming around breast cancer and all these other things is by doing research on the programming that exists so we can find out what the priorities of the community are. And I think this new Center for Public Health and Research is just a really good example of something that we can hope to kind of recreate in other places as well, so that we get South Asian perspectives from not just New Jersey, which I'm from New Jersey, which I love New Jersey a lot, but there's South Asians everywhere. And I think location also plays a role in how people feel about things, and especially in insurance status, which we talked about getting insurance coverage for different procedures. State to state, insurance coverage varies, and it's important to understand that, a person in Texas might have different needs based on their insurance status than someone in New York or someone in Illinois. Um, yeah, I think it's so great to hear about all the advances that we've made, and it sounds like we're taking really good steps in the right direction. And I hope that this report and all the work that we've done over the past year is just a catalyst for more work in this area, and to continue building a better future, I guess, for South Asians who may be diagnosed with breast cancer. As we kind of round out our conversation, were there any last thoughts or anything that you wanted to share with us?
I think this is a wonderful start. It's a continuation of the work that's been done at SAAPRI for the last year, and it's great that it's continuing. And we just need to keep getting out there and inform people, raise awareness, and participation, as you talked about in research, is critically important because we need to learn if our group has any specific gene mutations as they've diagnosed with other groups. And again, that's more information that you disseminate to the community. You get more participation. And again, with screenings and self-testing, you hope to alleviate some of the increases that we see in breast cancer.
Yeah. Well, thank you so much for joining us again. It was really great talking with you and getting your perspective on this.
Thank you. Thank you for asking me. And it was a pleasure to work with everyone at SAAPRI.